Hi, I'm Ashley James from Good Morning Maryland. Thank you so much for joining us today on our Facebook Live with GBMC. We do this every month and we always have great topics that we get to talk to experts about. Today, I am joined by Dr. Priya Little from GBMC to talk about the importance of a family doctor and also about a new clinic at the Helping Up mission that I know GBMC is very excited to talk about. So Dr. Little, thank you so much for joining us this morning.
Thank you, Ashley.
So let's start by just talking about a family doctor, family practice. Just in general, what does a family doctor really do?
Yeah, so a family doctor is what I've always thought of as a traditional doctor. So we provide general practice medicine. So we've been trained in a spectrum of medical care, all the way from hospital medicine and emergency room medicine to general adult medicine and pediatrics, from newborns up to teenagers. And we also get training in obstetrical care. So you have to have 40 deliveries before you graduate. Most of us have delivered more than 40 babies before.
Yeah.
And some family doctors still do prenatal care and labor and delivery. I don't personally, but I do a lot of gynecological care, including pap smears and birth control management. And we also do a lot of minor procedures in the office, like skin biopsies and cyst and lipoma removals and joint injections. So it's really geared towards family care, and we have a holistic approach because of the variety of trainings that we get. So we don't focus just on like one organ system like heart, lungs, gastrointestinal tract. We really look at the whole body, the whole person, their interaction with their environment, and the interaction with their families. One of the great things about being a family doctor is that you get to see families all together. So I have a lot of moms and babies that I see, and husbands and wives. And so it's a really great way to get to know someone on a more personal level too.
And we just want to say hi to those who are watching right now. Good morning, Sunny. And this is a great time to ask your questions. We want this to be interactive. We have a family doctor here today. So let's get all those questions answered while we're on Facebook Live. I had no idea that was some of the training that went into a family doctor. That's incredible. And you do cover so much. I have to ask, my husband's guilty of this, and I do think a lot of men in general. You know, I go to my family doctor anytime I'm sick or this, but my husband is, you know, he doesn't want to get a family doctor. I don't even know if he has a family doctor, honestly. So kind of talk about why it is so beneficial to have that one doctor you go see, or at least that team of doctors, because I know there's some people who, you know, they've been avoiding getting a family doctor and maybe going to like a clinic when they're sick. But what's some of the benefits of having that one person you see, or that team?
Yeah, I would say your husband is not the only man
Right.
who doesn't have a family doctor. Most of the men that I see for their physical exams, they say, "Oh, my wife Kate made this appointment for me. I don't know why I'm here." So, but primary care is really important. I would say it's like your gateway into medical care. It's really your starting point. So any medical concern that you may have, you should really start in the primary care office. So we can treat acute issues like sore throat, abdominal pain, headaches, cough, rash. You really want to start with your primary care doctor first, because usually we can address those types of issues. If we can't, if we think they're really emergent, we'll send you to the emergency room. Or if we think that they're more complicated and need to be addressed by a specialist, we can refer you to a specialist and of the appropriate specialty. And then we also provide preventive care. So, you know, routine physical exams where we screen for high blood pressure, for cholesterol, for diabetes, and for whatever routine cancer screenings that may be appropriate, like mammograms or colonoscopies and pap smears. We do all of those in the primary care office. And we also provide vaccinations, which are very important for preventive care as well.
That's
And
really
then,
great. Thank you so much for joining us. Oh, I'm sorry, Dr. Little. Do you want to finish your?
oh, sure. Yeah. And if we do find something on your physical exam and you end up having a chronic condition like high blood pressure or diabetes, we will help you manage those conditions in the long term. And it is important, the long-term aspect of it and the continuity of care, to have one primary care doctor, because that person will get to know you over time, and be able to perhaps diagnose your conditions better by knowing you better, and also help to create a more shared decision management plan once the relationship is created, where we know what the patient may want, because it is different for everyone.
Right. Certainly in COVID times, things are very different. And I think people are sort of torn with wanting to ask the doctor a million questions about it, but also not wanting to go into a doctor's office because people have been very scared. So I guess talk about how things have changed and what people can do to still be seen. Are you doing any telehealth medicine right now?
Yeah, we are doing telemedicine. We have video visits for any type of issue. We do them for follow-up issues, for follow-up diabetes or any other chronic condition. And we also do it for acute issues. So we try to triage it over the video visit as much as possible. And that's also how we take care of a lot of coronavirus concerns, because we can triage it over the video visit and refer you for a coronavirus test if needed, over the phone. And then if you do need to come into the office, we've taken a lot of precautions to keep the social distancing, and we're wiping down all of the surfaces on a very regular basis. Everyone is wearing masks. That's a top priority. And so we're doing our best to keep everyone safe and healthy.
Very good. All right. So this Helping Up mission, for those who maybe have never heard of Helping Up mission to begin with, just talk about what Helping Up mission is. And it sounds like there's a new clinic.
Yeah, so the Helping Up mission is GBMC's newest primary care site. It's located in Jonestown, which, if you don't know where that is, it's downtown Baltimore near Little Italy. And it was set up in partnership with the Helping Up mission, which is a substance abuse recovery center for mostly men right now. They do have a small number of women, and they're expanding their women's program. They actually just broke ground on a women's and children's center. So we're looking forward to that being created and seeing more women. But the Helping Up mission was looking for healthcare for their residents, and so they teamed up with GBMC to provide primary care services to their residents. So we started seeing the men and women at the Helping Up mission initially, and then we expanded to the entire Jonestown community and really anyone in the downtown area who needs primary care services.
Okay, so just to clear that up, so anyone in the downtown area who needs primary care service, it is available to them?
Yes. Mm-hmm. Yeah, it's open to everyone.
Okay, that's great to know. And you talked about why it's so important. Kind of explain, if somebody is hearing this and they say, oh, okay, this is a great opportunity for me to get in and see a doctor. What would your first time visit be like?
Yeah, if you don't have any particular concern, it would probably just be like a general checkup and physical exam. So we would get to know you, ask you about your medical history and, any family history that you may have that may put you at more risk for certain health conditions. We do a full physical exam, and then based on those findings, order any follow-up blood work or testing that may be necessary, depending on your risk factors.
Now, we live in this world of a pandemic right now, so I have to ask you, just a few sort of basic COVID questions that I know people are probably asking you. It seems like there are so many symptoms, right, that we've heard of. Like this could be a symptom, a sore throat, or a headache. Are you getting a lot of people just wanting to talk to their doctor and say, I have this, could it be COVID? I have this, could it be COVID? And what are you recommending to people?
Yeah, definitely. There are a lot of concerns, and it is also a new disease that we're still learning about. So there are a lot of unknowns, even within the medical community, about the coronavirus. So it's great to bring those concerns to your doctor instead of worrying about them all the time. So I have had a lot of conversations with my patients just about whether they should go to the grocery store or whether they should go to the pharmacy, and depending on what kind of medical conditions they have, if they should be going into the office or not. So it's definitely a conversation that's kind of individualized to everyone, based on their age and if they have any medical conditions. So I enjoy having those conversations with people, and usually they feel a lot better after talking it out, even if there may be questions that have been unanswered because we just don't know yet.
Right. I have to imagine that you are part family doctor, part therapist for some people, because I know when it comes to my doctor, just really having a conversation, and sometimes, it's what you said, it's an individual conversation, and I just walk away feeling better. I think that they've heard me, and I'm sure you see that a lot.
Yeah, and definitely primary care is also an entryway into mental health care, especially during this time of the coronavirus pandemic. There's been a lot of heightened anxiety and worsening depression. So we've been treating a lot of that in the primary care setting. And we also have therapists that we work with to help address those issues.
At the new clinic at the Helping Up Mission, is there COVID testing there?
We do not currently have COVID testing there. We do have coronavirus testing at the main GBMC campus, where we can refer patients to get their testing done there.
Okay. What do you want people to know about this new clinic?
I would say that it's just a general clinic for everyone to come to. We have a lot of accessibility, so sometimes it's hard to find a primary care doctor, but we are open to new patients of all ages, all backgrounds. I do speak Spanish as well, so open to people who have different languages, and we have translation services as well. So, even during this time where we're trying to social distance, healthcare is still very important. We did see, like in the first 3 months during that March, April, May time, that a lot of people were deferring their care because they didn't want to go in to get seen, and a lot of people were getting into a lot of trouble. Like there were more deaths from heart attacks and strokes because people weren't going to see their doctor, to go to the emergency room. So it is important to still access medical care, and we're doing it in a safe way, trying to keep the number of patients in the office down. So yeah, primary care is still important, preventive medicine, even despite the coronavirus.
So it sounds like it's very clear that if you're having any medical issues, do not be scared to go in. Do not let COVID scare you off from going in and seeing a professional.
Yeah, definitely. I would say, there's always the risks and benefits that you need to weigh. But if you're having an issue, and that's another thing that I talk to my patients about a lot is, whether they should come in to see me or do a video visit. And we always weigh those risks and benefits. So once you have a primary care doctor, you can help to address those concerns about whether I should come in, should I go to the emergency room. We're always available and open to answering those types of questions.
We have, I believe it's Savon, and she says, "That's my doctor. You are her doctor." So,
Oh, yeah.
yeah,
Hi.
well, so you will be there. You are one of the doctors. Is there a team of doctors in there?
Yes, it's me. It's me and a nurse practitioner, Vicky Hyatt, who are working there full time now, and Dr. James Baronis is also. He is our medical director down there.
Gotcha. And you may have said this, but I just wanted to double check. Is this a walk-in clinic, or is this a clinic where you make an appointment to go in?
Currently, you make an appointment to go in. We do have availability, so it should be pretty easy to make an appointment. We may expand to walk-in services, but we haven't decided that yet.
Okay. And how long has this clinic been open?
This clinic has been open about a year now, initially just to the Helping Up Mission residents, and then in January to the community at large.
Okay, so that's been a big deal. And how successful has it been so far? I'm assuming very once you started expanding it to the community.
Yeah, we've had a lot of success, especially with the Helping Up Mission folks. They're doing great work with substance use recovery at the Helping Up Mission, and the men are very motivated to get healthy. So it's been great working with them, and now slowly the people from the community have been utilizing our services, and it's been very successful so far.
Okay. And so just to check, people can come there just like they would for any care that a primary care doctor can offer.
Yes, that's correct. Mm-hmm.
Well, great. Well, is there anything else that you can think of that you want to share with our viewers today about whether it's, what family doctors do or family care, or this new clinic, your clinic?
I would just say that I'm looking forward to continuing to work in the new Jonestown Clinic at Helping Up Mission. And we're really excited to help advance the healthcare of that community down there, and all of Baltimore, really.
Yeah. Well, it's great work that you have done and are doing in the community. And we know that, our community needs it. And, especially in this pandemic, as you've said, people have been very nervous to seek treatment. And I think it's so important to get out there that, it's really important to see a doctor and to have a family care doctor. So we need to get everyone, if you don't have a doctor, right? You have one now, you can have one.
Yes. Yeah.
Okay.
We are available.
The website or a phone number that people can contact the clinic at?
Yeah, the website is www.gbmc.org/helpingup.
Okay, there we go. You see it on your screen, www.gbmc.org/helping up, as Dr. Little just said. Dr. Little, thank you so much for being with us and for all the information you gave us on what a family doctor does and this great clinic that you have available to our community.
Yeah, thank you so much, Ashley.
All right. Well, we will see you back here next month for our GBMC and WMAR Facebook Live. We always have great topics. Pass this along to people. This is some great information here about the new clinic, so you can always copy the link and send it to someone on Facebook who needs to hear. We'll see you back here next month. Have a great day.